PRP, medication, or transplant? Which one? What qualifications or degree do I look for while consulting a doctor or dermatologist? I've been suffering from hair loss for about 3 to 4 years. I'm very confused about it. Whatever hair I have in my scalp are gray. That's another issue, but I'm more worried about hair loss. I have no clue where to start from, or if I should even see a dermatologist. Hair treatments are expensive, and that's one of the reasons I never opted for a dermatologist. Now, the situation is worsening, and I feel if I don't do it now, then it's going to be very late.
Thank you for your question. You're basically asking about PRP versus transplant and hair loss treatments. And your question really, and you've submitted several photos, and your question really expresses very well the frustration that you and many people have when it comes to trying to find the, as you would describe, the most qualified doctor to help you with your hair loss. And you state also in the question that treatments for hair loss are expensive, dermatologists are expensive, and you're in a situation where you say that 3 to 4 years ago you started losing hair, and whatever hair you have in your scalp is also gray, which is a separate issue, and you're looking for probably the most cost-effective approach for treating hair loss. Well, I can certainly help you understand a little bit of a general perspective on how hair loss is treated. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I'm also the founder of TrichoStem Hair Regeneration Centers, a system that we developed from the procedures that we used to do a lot called hair transplant surgery, and it's a non-surgical approach to hair loss for many people like yourself who come to us from around the world using stem cell-based wound healing technology to treat men and women with thinning hair. So first, just to give you an understanding of why there is a challenge with finding the right doctor for your problem or anyone's problem with hair loss. Because the basic issue is, first, is establishing the correct diagnosis. Now, fortunately, common things happen commonly, and 95% of hair loss is genetic pattern inherited hair loss, referred to as androgenetic alopecia, and this applies to both men and women. Now, in the universe of options for treatment, the treatments are relatively narrow and small in number. And so if you were to start your journey with finding a physician, such as a dermatologist, you at least would get the important information you need to establish the diagnosis. And understand that treatment for hair loss or for anything that falls in the world of aesthetics is going to be expensive. There is no getting around it. And seeking opinions from doctors is, unfortunately, you're not going to necessarily always land on the right doctor for you on day one with the first appointment. There's a challenge there, and it's about finding the right fit for you and finding the right doctor, and it's not necessarily specialty specific. Everyone comes to hair loss from a perspective that works for them. And so if you were to reach out to a hair transplant doctor, well, there's a very good chance that the hair transplant doctor, not necessarily saying that they're 100% biased, but because their solutions are predominantly surgical, they will likely discuss with you the option of transplant surgery. They will also probably discuss with you the options for hair loss stabilization. So basically, I'll tell you how I counsel my patients, and I can say to you that from my perspective, there are essentially medical treatments, surgical treatments, and then there's the treatment that we developed called hair regeneration. And this is not intended to sell you on the idea of just one solution or one particular option. But understand that what you're dealing with from the photos you submitted, I think is a fairly aggressive pattern of hair loss that looks like genetic androgenetic alopecia. And that means that it's male pattern hair loss, and if it only started 3 to 4 years ago, you're losing hair at a very rapid pace. And my approach to someone like yourself would be is to inform you about the options of medical therapy such as minoxidil, which you probably know about, the topical application, as well as finasteride, which is a DHT blocker, dihydrotestosterone blocker, which can help up to 60% of men who, in terms of slowing down the progression, does not use for women. Now, that being said, unfortunately, a lot of men who come to our practice are reluctant to choose to take finasteride because they're afraid of reading about the potential long-term sexual side effects. Clinically speaking, I disagree with the perception of it being common when, in my practice and in the practices of many of my colleagues who I speak to, it is very rare to have any, no one I know can actually remember any patient who had a long-term sexual side effect. So in my experience, if someone were to have a side effect from finasteride, such as decreased libido, we stop the drug and they're back to their normal baseline. So having done hair transplant for many years, and we used to do anywhere from an average 3 to 5 transplants a week, we were trying to develop a solution to help the transplants heal better. And that solution was the use of a material called acellular matrix, which is a wound healing material that uses stem cell activity using adult stem cells from your own body to help improve wound healing. And that was with the intention of healing grafts better, as well as the donor area, the strip, the back of the scalp, where we harvest the grafts. Thinning hair started to get thicker in certain patients, and so we developed over the course of several years a predictable way or a consistent way to use an injection, and we call it hair regeneration. Basically, it's a combination of acellular matrix and PRP put together in a very specific way, which I inject at different levels of the skin to actually stop the progression of hair loss, to reactivate hair that's not growing, to induce the shed of thinning hair so that thicker hairs grow in. Now, often people say this sounds much too good to be true, and I can understand their skepticism. But we have over 5 to 7 years of data showing stability and effectiveness, and these results we've been able to establish occurred from just having just one injection. Now, I always customize these treatments, and so patients who have more moderate to severe hair loss, I find that if I do another injection, I'm actually strengthening further fine hairs that were literally rescued from near death, and those hairs get thicker around 15, when I treat people, somewhere around 15 to 18 months, and they get even more coverage. It's been such a successful solution as an alternative to hair transplant surgery that patients are coming to us from all over the world, and my patient coordinator has become kind of like an air traffic controller. So it's essentially important that I think that timing for you is critical. And I would say that in a situation like yours, I would want you to do medical therapy and hair regeneration treatment before considering hair transplant surgery. Now, to go back to answering your question, what should you look for? I think that you are going to have to do a lot of research, and you have to find the solution or the physician that you feel like you can trust in terms of being able to discuss with them your concerns, your budget, and what options are available. And unfortunately, time is not on your side. With this much advanced hair loss, once a hair is gone, and this is a limitation of hair regeneration treatment, is it's limited to the inventory of salvageable follicles. And I would say that the earlier we treat someone, the better it is. Our youngest male patient to date is 17, and our youngest female patient is 16. So genetic pattern loss can affect people at a very, very young age. In terms of cost effectiveness and your concern about cost in general, when I developed this, I developed it in a way so that it would be as accessible as possible. And I think that hair regeneration has been a significant cost savings for many patients who would otherwise have considered going for hair transplant. And not only do people like who need hair transplant get one, but generally they need multiple transplants because they continue to lose hair, especially if they're not on any medical therapy to stabilize their hair loss. So that's an important factor to include in how you are calculating things. But again, I would say that don't be afraid to spend some money to meet with doctors. You know, these are you are dealing with professionals who can help you, and if hair is important to you, like or anything else is important, you have to put in both time and money to find the right resources. I don't think anyone would ever say that there's only one solution for everybody and everyone should go to the same place. So that being said, consider what I've discussed in regard to your question, and then move forward with on your journey. Take a first step before you lose more hair. So I hope that was helpful. I wish you the best of luck, and thank you for your question.